Welcome to Real People, Real Voices. I'm your host, James Jackson.
And I'm your co-host, Pastor Wayne Moore.
Always a pleasure to host with you.
It is a blessing to be in the place. It's a blessing to experience the strength that I feel from you today.
Likewise, and it's good to be able to strengthen each other.
That's right. I think it's important that we learn how to do that.
Speaking of strength, we got some strong sponsors.
Some strong sponsors. You're right. We have Tamiko and Associates at Lavinia's and Summers, House of Funerals, Marion County Public Health Department, Lee Cossell and Crawley, Owl's Modern Clothing and Shoes. We're grateful to have his place, Eatery. Not only that, Fervent Care Christian Academy, and Northside Window, Gutter, and Cleaning, right here on the WHMBT Channel 40.
Yeah, and we use their services, and we encourage you to do so as well. Also, please be sure to go to WHMB TV 40 on YouTube. You can watch this show when it's over, as well as others that you might have missed. While you're there, please be sure to subscribe and
like us on Facebook. Hit us. We're right there waiting on you to let us come into your life.
And follow us on Facebook so you don't miss all that's going on. Thank you for allowing us to come into your homes on today. We really do appreciate you. Stay tuned. We've got some great guests, good folks from Marion County Health Department. They are here with us to talk about some things that you need to have your eyes on. So stick around. We'll be back after these very important messages. Well, welcome back. It's good to have you with us here on today on the Real People, Real Voices show. We've got some great folks here with us. Joining us today from the Marion County Health Department, Mr. Joshua Brown. Welcome to the program.
Thank you.
And Ms. Faith Brewer.
Hi.
Good to have you all with us today. And Joshua, if you tell us what your role is at the Marion County Health Department, and Faith, if you would do the same.
So I serve as a health educator and an outreach person. So we do various different kinds of health interventions, as well as educational partnerships with several non-governmental organizations and other community organizations in the city to raise the level of awareness about HIV, STDs, and substance use in the Indianapolis area.
And I am the Health Education Risk Reduction Program Coordinator. And with my program, I present educational presentations and counseling to at-risk populations and underserved populations.
That's interesting, Faith.
Thank you.
At risk.
Yeah.
Are the numbers very high as it relates to being at risk?
Yeah, I would say so. We've definitely had a total of 231 new cases of HIV and AIDS here in Marion County. That was last year of 2021. And then total just active cases, 5,229.
That number is still increasing, apparently.
Absolutely.
And it's just interesting, that's a great question, Dr. Moore, because a lot of people, I think, may not hear about it as much, and so people probably think, oh, that was back in the 80s and the 90s and everything's good. So how much of a fallacy is that? Do people really need to be concerned more so now than then?
Well, I think so, yes. I think that a lot of times, government will sort of adopt certain policies or public awareness campaigns that are kind of hot at the moment, but when those things sort of start to fade away, then people tend to forget about them. And in the 80s and the 90s, we were seeing a large level of awareness. That was my formative years coming up, and there was a lot of music videos and television advertisements, and it was in your regular after-school programming talking about the need to use protection when having sexual intercourse in order to mitigate the spread of HIV, and it was really kind of looming large in our culture. And I think it's kind of a victim of its own success, some of those campaigns, and sort of raising awareness and the importance of wearing condoms and taking certain precautions and getting tested and things like that. And so as a result of that, a lot of the younger kids coming up today don't hear about it as often as they once did, and as well as the pharmacological improvements that have been sustained in the movement that have also made a lot more manageable of a disease to have today.
Faith, the counseling piece. How do we get an individual to say, I have it, but some try to live without the wraparound services? Say a person is making a decision and they say, well, now I'm ready to treat this particular issue that I have with wraparound services. How do you go and get a person acclimated in that circle of life, that new life that they're going to?
Absolutely. So when we do testing and we get a reactive result, which is known as a positive result, we will do a confirmatory test to confirm that reactive result. We will also take a blood sample and send that off to the labs as well. But the minute we get that reactive result, we have a counselor in the room with that person that is going to immediately link them to care. Ryan White offers a lot of services for people that are living with HIV, rent, housing, medical needs. So they really work with people. We make sure we don't let anyone go home after receiving some type of reactive result. We make sure that, like I said, we immediately get them linked to care. And we just counsel them on, this virus and how it works and, what's important so that they can live a long, healthy life, basically.
And you said that we have a little more than 5,000 active cases. Is that all of Indiana or Marion County?
So that's just Marion County. We have what we call the transitional grant area, which covers 10 counties here in Indiana, the central Indiana counties. So Marion, Hamilton, Hancock, Shelby, Johnson, Brown, Morgan, Hendricks, Boone, and Putnam. Within that area, there are 6,174 cases of people living with HIV and AIDS.
So Marion County is the biggest, the hot spot.
Because we have the most people.
Population.
Yeah, we have the highest population, but we are seeing the highest incidence of cases in 46201, so downtown, 46235, that's 38th Street on the east side. On the west side, we're seeing just the highest incidence of cases, but yes, it's 5,229 active cases of HIV.
Three hotspot areas in Marion County, downtown, east side of Indianapolis, and the west side of Indianapolis.
Absolutely.
Out of those three areas, which is the hottest, the downtown area?
Yes, 46201.
Wow.
Absolutely.
Is the Black community disproportionately impacted by this, or do you know?
100%.
Is this by drug use?
So it's a couple exposure categories. So men who have sex with men, that category is the highest risk exposure here in Indianapolis. Also injection drug use, so sharing needles and equipment. But then we are also seeing an increase in heterosexual contact, that people are getting HIV from that as well. But it is negatively impacting the African American community, as well as the Latinx community. Yep. And so out of the 231 new cases we had in Indianapolis last year, 136 of those cases were African American.
I do think it's important to stress that, that doesn't mean that Black and African American people are the only people who are at high risk for possibly contracting the disease. It just so happens that there are a lot of other social determinants of health, as I'm sure many of you know, that lead to our disproportionate, representation, not just in HIV, but in also other, health ills.
Yeah.
So with all the variants, because we've been, of course, dealing with COVID-19, and we have variant after variant after variant, and the meta-narrative is each variant, the virus is usually not as lethal as the original. Does that hold true with HIV/AIDS, where we've come this far, and if you contract the virus, it's not as deadly as it was, or without care, is it deadly?
Well, yeah, I can only speak to what I do know. I know that there are two major categories of HIV infection, so HIV type 1 and type 2. Type 2 is much more prevalent in sub-Saharan Africa, so and type 1 is much more prevalent in the Western world. But there is, as far as, is sort of relevant to the conversation, no difference in terms of its level of I guess the effectiveness that it has in doing damage to a person's body and their immune system. So yeah, I guess you could say lethality of it is not been diminished over time as a result of people continuing to spread or become infected.
We'll pause there. We've got to take a quick break. When we come back, we've got more from the Marion County Health Department on HIV, AIDS, and the care. And there's a big day coming up. We'll be back after this. Welcome back to Real People, Real Voices. We're here with Joshua Brown and Faith Brewer, Marion County Health Department. And before the break, we were talking about care and the issues with HIV, AIDS. Kind of going back into what we were talking about, but starting off with some solutions. There's a big day coming up. Can you tell us about that?
Yes, so on June the 27th, that's a Monday, is the National Observance of HIV Testing Day. So it's a national observance that's is going to be I guess observed is the word I'm looking for, all across the country. We happen to be partnering with Walgreens and Greater Than AIDS at 2 Walgreens locally here, so at 38th and Sherman and 16th and Meridian. We will be conducting HIV testing all day that day. There will be a little bit of fanfare involved, so we do have some other local community partners, including the Indianapolis Urban League and the Women in Motion, as well as Radio 1 and the Latin radio station, is it WEJD, DJ? So it should be a good time. We're going to have our mobile units out there interacting with people, sharing information, and hopefully we'd like to see you all come out.
Education piece on the needle situation, Faith. Could you give us some insight on that, on how, we do have mobile units that move around the state in a needle exchange system that was created and partnered with other people along with the Marion County Public Health Department. Could you elaborate on that? Because that's one of the pieces that people are affected by as it relates to HIV, am I right?
Okay, so I am not super familiar with the needle exchange program, but I am aware that the premise there is we want people to use clean needles, clean equipment, so that there is a lesser risk of transmitting HIV and hepatitis C, some of those other viruses and illnesses. And so the purpose of the Clean Needle Exchange program is just to make sure that we're providing people with the materials to participate in these behaviors, regardless of what we think about. We just want to make sure that they're being safe while they do so. And so that's my idea. Did you have anything to add, Josh?
Josh, let me ask this question to you. The hepatitis piece, in conjunction with what Ms. Faith was talking about as it relates to needles and hepatitis C?
C.
Yeah, go right ahead, elaborate on that.
Well, there's I don't know if you all remember back in, I think it was 2015.
Right.
In Scotts County.
Right.
There was a large I guess you want to call it an outbreak of HIV infection and hepatitis C infection as a result of, I think some of the local public health services had been sort of peeled back in that area. And, as a result, we all living during several crises. I guess one of them that's really prominent right now is the opioid crisis. When patients or persons are maybe overprescribed medications and they can no longer get access to those medications, a lot of times they may turn to illicit drug use in order to sort of supplement those needs. And when you can't get access to clean and sanitary needles, you're going to be sharing them with the friends of yours that also shoot up drugs. And so as a result of that, you're essentially exchanging bodily fluids that have a high probability of carrying some of these bloodborne pathogens such as HIV or hepatitis C. So, part of what we do in the Substance Use Outreach Services program, working in the community, we're seeing a large cross-section of comorbidities with HIV infection as well as hepatitis C infection as well. So we're sort of attacking both of those problems
at the same
time.
Mm-hmm.
Yeah. I think it's important because the rise in it, I think a couple of years ago, it was at Scott County, but it has not diminished as much as we had anticipated it to diminish, and it has still been rising steadily.
Yeah.
That's the Hep C piece I'm talking about.
Mm-hmm.
Yeah.
So talk about the impact that this has on our community. Of course, the direct impact on the lives of the people who contract these diseases, but reverberating further out, talk about some of the impact that it has on our community.
I could say that I really think that one of the biggest impacts a lot of times that people overlook, because a lot of these diseases, especially HIV now in 2022, we've come a long way with regard to our ability to treat it, and it's a much more manageable chronic illness. Unfortunately, one of the biggest impacts, especially on an individual level, are going to be the stigma that people receive as a result of having had a positive diagnosis. And part of our job as educators is to help to inform people of the realities in current modern day of dealing with and living with this disease, and to show people that whether it's something that someone really wants to have, it's a manageable disease. It's not quite the boogeyman that we grew up knowing it to be, and lowering that level of stigma can make the lives of the people who are infected much more manageable and much more pleasant.
Josh, it did have a bad stigma going into it, but once it was, Dr. Jackson, once the education got out there, the stigma reduced to a seriousness. But it's in society, and now that it's in the system of society, it's so hard to combat because there's so many people who are living lifestyles in denial. And they don't realize it until they find themselves in these places that, this lifestyle or whatever it was, whether it be drugs, alternative lifestyles, this is what the results of it can be. Not only that, but the Hep C piece as well.
I really think that lowering the level of stigma can help to encourage a mitigating of the overall spread of the disease, because if people feel more comfortable coming forward to get tested, they're not scared of getting that positive result quite as much. And the focus of the overall HIV arena has changed from being as much focused on prevention as it is to finding those persons who are infected, who are maybe out of care or not in care, and getting them on medication so that their viral load is suppressed, and then they're not able to pass those things on to other people.
We've got about 1:20 left. This from either of you. Symptoms, how would someone know that they need to get tested, or should people just get tested?
So I would definitely say the CDC recommends that everyone between the ages of 13 and 64 get tested at least once in their lifetime for HIV. But it basically is about the behaviors that you participate in. So if you're participating in some of those riskier behaviors, having sexual intercourse with multiple partners or without protection, then you may need to be tested more often than someone that is not participating in those behaviors. As far as symptoms, it's the common flu-like symptoms. So fever, chills, sore throat, possibly a rash. But the thing with this is it's a virus, and so it looks different in different people. In today's world, you might think you have COVID. You might have been exposed to HIV and, you think you have COVID and you quarantine for a couple of weeks, but it might be actually HIV. So getting tested is the one surefire way to know.
Thank you both.
Thank
You've been
you.
great guests.
Absolutely.
Thank you for being with us. We have the rundown next. We'll be back after this. Welcome back to Real People, Real Voices. I'm your host, James Jackson.
I'm the co-host, Dr. Wayne Moore.
And I'm your producer, Curtis Baker.
And speaking of producers, we have been blessed to produce a lot of great sponsors.
A lot of great sponsors, so many, sometimes you just have to read them off because you may forget one, so I'm going to read them. Tamika and Associates, Lavinia Summers Home of Funerals, Marion County Public Health Department, Lee Castle and Crawley, Al's Modern Clothing and Shoes, Northside Window and Gutter Cleaning, Fervent Care Christian Academy, and His Place Eatery, located at 30th and Shaylin. Friday Night Fish, guys need to stop in.
Yeah.
And all those great
All great sponsors.
companies, and they do great work. That last interview there, I don't think people think about it as much as they used to. And it is a deadly virus. And according to our guest, Joshua and Faith, infections are on the rise with HIV and AIDS.
My friend, I tell you one thing that is so obvious is that the pandemic is almost feeling like that. That it is falling into the same behavior in the minds of people as the HIV and hepatitis C. And so we have a lot to be concerned about whether or not people think it's serious or not. Over 230 cases last year almost, she said. And Marion County is the hot spot. And the downtown area is the most fluent,
Most active.
most active place. So those are kind of things that we need to be watching. But I just hope our community does not fall in the place of taking it for granted like we have HIV and hepatitis C.
Yeah, you mentioned it. It's kind of like with COVID now, people are kind of getting so relaxed and it's pushed off the front page and the front news and people forget. It hasn't gone anywhere. And as we've seen today, the HIV cases haven't either. I think people have kind of not taken it as serious as they did in the 80s. I think you mentioned that.
Yeah.
I'm not sure the death rate is probably subsided. There's treatment now, obviously more so than it was back then, but it's still a serious virus that we need to take, pay attention to for sure.
So thank you for being with us on today. We really do appreciate it. Abstinence is the best, and don't do drugs. But if you decide that you're going to involve yourself in those risky activities, as was indicated by our guest, be sure that you take the proper precautions. Thank you for joining us. We'll see you next time.